Hello, I'm Dr. Emily Carter, and before we begin, let me ask you something important. When was the last time you checked your blood sugar and actually paid attention to the number? Not just glanced at it, not just assumed everything was fine, but truly understood what it meant. Because after the age of 40, one of the most dangerous conditions doesn't cause sharp pain, dramatic symptoms, or immediate alarm. It develops quietly, gradually. And by the time most people notice something is wrong, the damage has already been progressing for years. I'm talking about prediabetes. Prediabetes is not diabetes yet, but it is not normal either. It is a metabolic warning sign. It means your blood sugar levels are higher than they should be, your insulin is working harder than it should, and your cells are becoming resistant to its signal. This stage can last for years without obvious symptoms. That is what makes it so dangerous. After 40, your metabolism naturally changes. Muscle mass slowly declines, stress accumulates, sleep becomes lighter, and insulin sensitivity decreases. The same diet that did not cause problems in your 20s may now push your system toward imbalance. One of the earliest and most common signs of prediabetes is fatigue that does not make sense. You wake up tired even after sleeping. You feel a heavy drop in energy after meals. Around 3 or 4 p.m., you feel like you need sugar or caffeine just to function. This happens because your blood sugar spikes quickly after eating refined carbohydrates. Your pancreas releases insulin to bring that sugar down. But when cells are resistant, insulin has to work harder. Blood sugar may drop rapidly afterward, leaving you feeling drained, shaky, or irritable. It becomes a roller coaster of spikes and crashes. Another early sign is constant hunger, especially for sweets. Insulin resistance creates a paradox. There is glucose in your bloodstream, but your cells struggle to use it efficiently. Your brain interprets this as low energy, so it sends hunger signals. You crave fast carbohydrates because they temporarily raise blood sugar quickly. But this only deepens the cycle. More sugar means more insulin. More insulin promotes fat storage and further resistance. Stubborn weight gain around the abdomen is another major signal. After 40, hormonal shifts already favor abdominal fat storage. Chronically elevated insulin makes fat burning more difficult. Even if you reduce calories slightly, high insulin levels can block fat mobilization. You may feel like your body has changed and nothing works anymore. This is not a failure of willpower. It is a hormonal environment problem. Increased thirst and more frequent urination can begin subtly. When blood sugar stays elevated, your kidneys attempt to remove excess glucose through urine. This pulls water with it, leading to dehydration and thirst. While these symptoms are more dramatic in full diabetes, early changes can appear during prediabetes. Brain fog is another overlooked symptom. The brain requires stable glucose levels. Rapid fluctuations impair focus and memory. You may struggle to concentrate in meetings or forget small details more often than before. Mood swings can also occur because unstable blood sugar affects neurotransmitter balance. Sleep disturbances are strongly linked to insulin resistance. High evening cortisol and unstable glucose levels can cause nighttime awakenings. Poor sleep then worsens insulin sensitivity the next day. Even 1 week of sleep restriction has been shown to reduce insulin sensitivity significantly. Now let's talk about laboratory markers, because numbers matter. A fasting glucose between 100 and 125 milligrams per deciliter indicates impaired fasting glucose. A hemoglobin A1C between 5.7 and 6.4% reflects average blood sugar elevation over the past 3 months. An oral glucose tolerance test showing a 2-hour value between 140 and 199 also signals prediabetes. These values may look only slightly elevated, but metabolically they represent stress. Many people are told their numbers are borderline and not to worry. But borderline is the stage where intervention is most powerful. Waiting until values cross into diabetes means more damage has occurred. What happens if prediabetes is ignored? Chronically elevated insulin and glucose gradually damage blood vessels. The inner lining of arteries becomes inflamed. This increases cardiovascular risk. nerve tissue can begin to suffer. Vision changes may develop slowly. The pancreas continues to work overtime producing insulin. Over years, beta cells may begin to fail. At that point, blood sugar rises further, and type 2 diabetes is diagnosed. The progression is slow but real. Let me describe a common scenario. A 45-year-old man with mild belly fat, normal cholesterol a few years ago, now has triglycerides creeping upward. His fasting glucose is 108. His A1C is 5.9. He feels tired in the afternoons and relies on coffee. He assumes it is aging. In reality, his metabolism is signaling insulin resistance. Or consider a 48-year-old woman entering perimenopause. She notices weight gain around her waist, increased sugar cravings, and disrupted sleep. Her fasting glucose is 102. Her doctor says everything is fine. But metabolically, the trajectory is shifting. The encouraging truth is that prediabetes is often reversible. Insulin resistance responds remarkably well to consistent lifestyle adjustments. The first priority is stabilizing blood sugar. This means reducing refined carbohydrates and eliminating sugary beverages. Liquid sugar is particularly harmful because it causes rapid spikes without creating fullness. Replacing soda, sweetened coffee drinks, and fruit juices with water or unsweetened tea can significantly lower daily glucose load. Protein intake should be prioritized at every meal. Protein slows glucose absorption, increases satiety, and supports muscle preservation. Muscle tissue is one of the most powerful tools against insulin resistance because it acts as a storage site for glucose. Resistance training 2 to 3 times per week increases muscle mass and improves insulin sensitivity. Even moderate strength training produces measurable improvements. Walking after meals is one of the simplest interventions. A 15 to 20-minute walk helps muscles absorb circulating glucose and reduces post-meal spikes. Over time, these small reductions accumulate into significant metabolic improvements. Sleep must become non-negotiable. 7 to 8 hours of consistent sleep improves insulin sensitivity, regulates appetite hormones, and reduces cravings. Managing stress lowers cortisol and reduces blood sugar elevation. Deep breathing, time outdoors, structured relaxation, and limiting late-night screen exposure all contribute. Hydration supports kidney function and glucose regulation. Adequate water intake helps the body manage blood sugar more efficiently. Even modest weight loss of 5 to 7% of body weight has been shown to dramatically reduce progression from prediabetes to diabetes. But the goal is not extreme dieting. Rapid weight loss followed by regain often worsens insulin resistance. Sustainable habits are the solution. Prediabetes is not a life sentence. It is a window of opportunity. It is your body signaling that the current trajectory needs adjustment. The earlier you respond, the greater the chance of full metabolic recovery. After 40, health becomes intentional. The habits you practice daily either improve insulin sensitivity or worsen it. Every meal influences glucose levels. Every workout improves cellular response. Every night of quality sleep repairs metabolic pathways. If you recognize fatigue, abdominal weight gain, sugar cravings, brain fog, subtle lab changes, or increased thirst, consider testing and discussing results with a healthcare provider. Early awareness allows prevention. Your metabolism is adaptable. Cells can become more sensitive to insulin again. Muscle can be rebuilt. Blood sugar can stabilize. Energy can return. The body responds when given consistent support. Prediabetes is not meant to create fear. It is meant to create awareness. Prevention at 40 is far easier than managing complications at 60. Small daily adjustments repeated consistently reshape your metabolic future. Your long-term vitality depends on the habits you build today. Listen to early signals. Act before progression. Protect your metabolic health now so you can maintain strength, clarity, and energy for decades to come.